COVID-19 vaccination training. This training includes 4 modules. Module 1 is intramuscular injections. Module 2 is on the medical management of vaccine reactions. Module 3 is vaccine preparation on preparing reconstituted vaccines and drawing up vaccines. And Module 4 is a vaccine overview of the Pfizer, BioNTech, and Moderna vaccines. The objectives of this training are to provide a refresher on giving IM injections, providing training on the medical management of adverse reactions, provide a brief overview of the Moderna and Pfizer COVID-19 vaccines, and to answer any and all questions. Module 1, Intramuscular Injections. The deltoid muscle is the common site for giving IM injections. It should be used for adults, adolescents, and children 4 and older. Use anatomical landmarks to identify the deltoid muscle and the correct site for injection. To identify the injection site, feel for the bone, the acromion process, that's located at the top of the upper arm. The correct area to give the injection is 2 to 3 finger widths below the acromion process. At the bottom of the fingers will be an upside-down triangle. Give the injection in the center of the triangle. Ensure the deltoid muscle is relaxed, as it will make the injection less painful. Up next, you will see a quick video showing this process.
This is a demonstration of an IM injection. Before you start, gather all your supplies. You'll need a syringe, a needle of appropriate length and gauge, sterile alcohol wipes, a 2x2 gauze pad, Band-Aids, and a puncture-resistant sharps container. The most common site for an IM injection for adults, children, and older toddlers is the deltoid muscle. It is recommended that in giving this injection, use the non-dominant arm of the patient. In finding the correct site, feel for the bone that is located at the top of the upper arm, also known as the acromion process. The correct area to give the injection is 2 to 3 finger widths below the acromion process. At the bottom of the fingers will be an upside-down triangle. Give the injection in the center of that triangle and ensure that the deltoid muscle is relaxed, as it will be less painful for the person. Step 1, gather your supplies and expose the syringe and needle. Attach the needle to the syringe. And using this to draw up your vaccine. Once complete, you find your landmarks. Begin by cleaning the area in a circular motion, and then allow it to dry. Once dried, remove the needle cap and hold the syringe between your thumb and forefinger and insert the needle at a 90-degree angle. And inject. Once complete, discard the needle in a sharps container. Cover the site with a 2x2 gauze pad. And hold in place and apply a Band-Aid. Once this is done, have the person sit in the waiting area and observe for 15 minutes for any type of reaction.
Your injection supplies will include a syringe, a needle of appropriate length and gauge, sterile alcohol wipes, a 2x2 gauze pad, Band-Aids, and a puncture-resistant sharps container. Preparing your client for injection. Use simple strategies to ease vaccination process. Have a positive attitude, speak in a soft, calm voice, make eye contact, explain why the vaccine is needed, and be honest about what to expect. In positioning and comforting for restraint, be aware of syncope, also known as fainting. Have the patient seated and, if necessary, lying down during the vaccination. Be aware of the symptoms that precede syncope. If the patient faints, provide supportive care and protect the patient from injury. Observe the patient whether they're seated or lying for at least 15 minutes after vaccination. Preparing to administer the injection. First, clean the site with an alcohol pad in an outward circular motion, and then allow the alcohol to dry. Remove the needle cap. Hold the syringe between your thumb and forefinger and insert the needle at a 90-degree angle. Now with the needle inserted, do not aspirate. Simply push down on the plunger to administer the vaccine. Then quickly remove the needle and place the needle and syringe in a sharps container. Remember, never recap a used needle. Once you've discarded the needle and the syringe in the sharps container, cover the vaccination site with a 2x2 gauze pad and hold the pad in place and apply a Band-Aid. Module 2, Medical Management of Vaccine Reactions. Administering any medication, including vaccines, has the potential to cause an adverse reaction. To minimize the likelihood of an adverse event, screen patients for vaccine contraindications and precautions prior to vaccination. When adverse reactions do occur, they can vary from minor symptoms such as soreness and itching to rare and serious anaphylaxis. Be prepared. Vaccine providers should know how to recognize allergic reactions, including anaphylaxis. Have a plan in place and supplies available to provide appropriate medical care should such an event occur. Management of localized adverse reactions. Soreness, redness, itching, or swelling at the site of injection can be managed by applying a cold compress to the injection site. Consider giving an analgesic, a pain reliever, or an antipyretic medication. Slight bleeding, apply pressure and an adhesive compress over the injection site. For continuous bleeding, place a thick layer of gauze pads over the site and maintain direct and firm pressure. Raise the bleeding site above the level of the patient's heart. Signs and symptoms of anaphylaxis. Some of those signs and symptoms include swelling of the conjunctiva, runny nose, swelling of the lips, tongue, and throat, or respiratory issues such as shortness of breath, wheezing or stridor, hoarseness, pain with swallowing, and cough. Medical management of anaphylactic adverse reactions. The most common treatment for an anaphylactic reaction is epinephrine. It's either delivered via an EpiPen or a hypodermic needle. Some of those symptoms include hives, itching, flushing, swelling of the lips, face, throat, or tongue. Respiratory symptoms can include nasal congestion, changes in the voice, wheezing or cough, and gastrointestinal symptoms can include vomiting, diarrhea, cramping, and abdominal pain. Adverse reactions on different skin tones. It's important to know different skin tones and what they look like with the adverse reactions. Slide 1 and 2 shows you hives on a light complexion and then a dark complexion. Slide 3 and 4 show what a disseminated rash looks like. It's very important to be able to recognize the onset and a full reaction of an adverse reaction. Study these pictures and learn them well. Up next is a quick video on the use of an EpiPen.
Now we're going to demonstrate the use of an EpiPen, also known as the EpiPen auto-injector, which contains 0.5 cc's of epinephrine. This is used for severe allergic reactions, also known as anaphylaxis. After vaccination, a person should be observed for 15 minutes for any signs of allergic reaction or anaphylaxis.
Are you okay? Are you having trouble breathing? You're not okay.
Okay. Have patient bend leg at knee. Remove the blue cap and place the orange end against the person's lateral thigh. Press till you hear a click and hold for 10 seconds to ensure that the epinephrine goes through. Remember, there's no need to remove clothes injected straight through the clothing. Then observe the patient and always call 911 if an EpiPen is needed.
The management of psychological fright, pre-syncope, and syncope. Aside from adverse reactions, you may also have some other things going on. For a person who is exhibiting fright before an injection is given, have the patient sit or lie down for the vaccination. If the patient feels faint, lightheaded, dizzy, weak, nauseated, or has visual disturbances, have them lie flat, loosen any tight clothing, and maintain an open airway. Apply cool, damp cloths to the patient's face and neck, and keep the patient in close observation until a full recovery. For someone who falls out without loss of consciousness, examine the patient to determine if injury is present before attempting to move. Place patient flat on the back with feet elevated. Module 3, Vaccine Preparation. During the entire vaccination process, good infection control measures are necessary. That includes hand hygiene, which should be performed before vaccine preparation, between patients, and anytime your hands become soiled. Gloves are not required when administering vaccines unless the person administering the vaccine is likely to come in contact with potentially infectious body fluids or has open lesions on their hands. If gloves are worn, they should be changed and hand hygiene performed between patients. Your equipment needed for vaccination and drawing up your vaccines include syringes, alcohol pads, the vaccine, and, if it needs to be reconstituted, the diluent. Reconstituting a vaccine. Remove plastic cap and cleanse the stopper with alcohol and let dry. Uncap your needle. Hold the diluent vial steady on the counter. Insert the needle into the center of the stopper. Invert the vial and pull needle back so the tip is in the liquid. Draw up the specified amount of diluent into the syringe and withdraw the needle. Hold the vaccine vial steady on the counter. Insert needle into the center of the stopper and inject all the diluent. Hold the vial and syringe together and mix per instructions of the manufacturer. Drawing up the vaccine will be covered on slide 27. You will now see a quick video on this process.
Reconstituting a vaccine, drawing up diluent. First, remove plastic cap and cleanse the stopper with an alcohol pad, and then let it dry. All right, uncap your needle and attach it to the syringe. Hold the diluent vial steady on the counter and insert the needle into the center of the stopper. Invert vial and pull needle back so tip is in the liquid. Draw up a specified amount of diluent into the syringe and then withdraw the needle. Remove the cap from the vaccine and hold the vial steady on the counter. Insert the needle into the center of the stopper and inject all the diluent. Holding vial and syringe together, mix per manufacturer's instructions, whether you invert or swirl. Remove and discard needle and syringe. Mix per manufacturer's instructions, whether it be swirl, invert, or shake. Clean the vial with an alcohol pad, definitely with each use, and allow to dry. Remove cap of needle and place cap on a clean surface. Insert needle into center of stopper. Invert vial and pull needle back so tip is in the liquid. Pull back on plunger and drop amount of specified vaccine. Pull dry needle and tap syringe and push out air. Recap the needle. The vaccine is now ready to administer.
Drawing up your vaccine. Clean the vial with an alcohol pad with each use and allow the alcohol to dry. Remove the cap of the needle and place the cap on a clean surface. Insert the needle into the center of the stopper. Invert the vial and pull the needle back so the tip is in the liquid. Pull back on the plunger and draw up the needed amount. Withdraw the needle and tap the syringe and push out the air. Recap the needle and use the vaccine promptly. Module 4, COVID-19 Vaccines, a brief overview. COVID-19 vaccines. There are two that have been authorized with an emergency use authorization. They are from Pfizer, BioNTech, and Moderna. Both products demonstrate a high efficacy across all age groups, racial and ethnic groups, and persons with underlying conditions. They are both acceptable and safe, and the local and systemic reactogenicity are particularly after second doses. Co-administration with other vaccines. The Moderna and Pfizer vaccine should be administered alone with a minimum interval of 14 days before or after administration of another vaccine. This is due to the lack of data on safety and efficacy of the vaccines administered simultaneously with others. If the Moderna and Pfizer vaccines are inadvertently administered within 14 days of another vaccine, neither of the doses need to be repeated. Contraindications to vaccination. Prescribing information for both the Pfizer and Moderna vaccines say severe allergic reactions to any component of the vaccine is a contraindication to vaccination. Appropriate medical treatment used to manage immediate allergic reactions must be immediately available in the event of an acute anaphylactic reaction occurs following administration of the vaccines. The Moderna vaccine. The Moderna vaccine consists of 2 doses of 0.5 milliliters administered intramuscularly 28 days apart. The second dose should be administered within a 4-day grace period and will remain valid. If more than 28 days has passed since the first dose, the second dose should be administered at earliest opportunity, but no doses need to be repeated. This vaccine is authorized for use with persons 18 and older. Vaccines are not interchangeable with other COVID-19 vaccines, so both doses should be completed with the same vaccine. If the 2 doses are different and inadvertently administered, no additional doses of either vaccine are recommended at this time. Both doses are necessary for protection. Efficacy of a single dose has not been systematically evaluated. The Pfizer BioNTech vaccine. This is a 2-dose series of 0.3 milliliters administered intramuscularly 21 days apart. This vaccine is reconstituted with 1.8 milliliters of accompanying diluent. Administration of the second dose should be within a 4-day grace period and will be valid. If more than 21 days has passed since the first dose, the second dose should be administered at the earliest opportunity, but no doses need to be repeated. This vaccine is authorized for use with persons 16 and older. This vaccine is not interchangeable with other COVID-19 vaccines, so both doses should be completed with the same vaccine. If 2 doses of different vaccines are inadvertently administered, no additional doses of either vaccine are recommended at this time. Both doses are necessary for the protection, as efficacy of a single dose has not been systematically evaluated.